Hello, my name is Ruben Padilla Diaz, and this presentation covers the evaluation and sustainability plan for Healthy Heights, Peru. This project aims to address childhood stunting in rural Andean communities. I'll briefly walk through the program overview, SMART objectives, evaluation design, logic model, sustainability approach, and health equity integration. Childhood stunting remains a significant health disparity in rural Andean Peru, especially among indigenous Quechua speaking families. These communities experience limited dietary diversity, transportation barriers, and economic constraints, which all contribute to poor growth outcomes. Because structural barriers disproportionately affect these indigenous households, stunting is both a nutrition issue and a health equity issue. Healthy Heights Peru focuses on children under 5 in these high altitude communities. To understand the scope of this issue, I used several data sources, including the Peru DHS, WHO, growth standards, clinic records, and interviews with caregivers. I found that stunting rates often exceed 25%. Caregivers rely heavily on potato based diets, have limited complementary feeding knowledge, and rarely receive education in Quechua. And for our stakeholder influence, local health posts, community promoters, and village leaders, as well as municipal nutrition offices, guide program priorities and ensure the program reflects community needs. The program uses social cognitive theory as its foundation. The theory of change is that if caregivers are given culturally relevant knowledge, practical skills, and consistent support, then feeding behaviors will improve and children's growth will benefit. SCT supports this through observational learning, through cooking demonstrations, self efficacy building, and reinforcement during home visits. Now, there are three SMART objectives. First, train 20 community health educators by June 2026. Secondly, increase caregiver feeding knowledge by 30% by December of 2026. And third, reduce stunting prevalence by 20% by December 2027. Each objective has measurable indicators such as pre and post test and standardized height for age measurements. The evaluation uses a mixed methods pre post design. Process evaluation looks at whether workshops were delivered as planned, whether educators were well trained, and how engaged caregivers were. Outcome evaluation measures changes in caregiver knowledge, feeding practices, and child growth indicators. We support validity through anthropometric training, accurate translation into Quechua, and minimizing loss to follow up. Quantitative data include caregiver surveys, growth measurements, and attendance logs. Qualitative data include focus groups, promoter interviews, and home visit observations. We use a census sampling approach, meaning all families served by the local health post are included. This ensures complete coverage of children under 5 in the area. The logic model here summarizes how resources link to outcomes. Inputs include funding, promotoras, and curriculum materials. Activities include educator training, workshops, and home visits. Outputs track the number of trainings and caregivers reached. Short term outcomes focused on improved caregiver knowledge. Intermediate outcomes include the better dietary practices. And finally, long term outcomes center on reduced stunting and stronger community nutrition capacity. Sustainability relies on strong partnerships and diversified funding. Potential sources include the Peru Ministry of Health, UNICEF, PAHO, and NGOs such as CARE Peru. Capacity building is key. Promotoras will continue delivering the curriculum long term, and growth monitoring will be integrated into existing clinic routines. Documenting procedures also ensures continuity if staff turnover occurs. In order to support long term impact, the program is designed for scalability and integration. It can expand to neighboring villages and be adapted for schools or agricultural cooperatives. Embedding feeding education into routine health post visits and aligning with national nutrition strategies helps us institutionalize the program. Mitigation strategies would include diversifying funding and strengthening promoter training pipelines. Health equity is central to the program. To reduce structural barriers, all materials are offered in Quechua. Workshops are held locally at no cost, and promotoras co-design the curriculum. The goal is to reduce the disparities in child growth while expanding access to culturally meaningful nutrition education. In summary, Healthy Heights Peru improves nutrition knowledge, strengthens the local health workforce, and supports better growth outcomes for children in rural Andean communities. The evaluation plan guides program improvements, and the sustainability framework ensures that the program remains viable and impactful over time. Thank you very much for your time.